Schizophrenia is a serious and chronic mental illness that impairs a person's thought and behavior, and if untreated can include psychosis. Characterized by delusions, hallucinations, and other cognitive difficulties, schizophrenia can often be a lifelong struggle. Genetic and environmental factors add together to bring about schizophrenia. It most commonly strikes between the ages of 16 and 30 years, and males tend to show symptoms at a slightly younger age than females. Symptoms and signs of schizophrenia will vary depending upon the individual. The symptoms are classified into 4 categories. Positive symptoms, also known as psychotic symptoms, for example, delusions and hallucinations. Negative symptoms, these refer to elements that are taken away from the individuals. For example, absence of facial expressions or lack of motivations. Cognitive symptoms, these affect the person's thought processes. They may be positive or negative symptoms. For example, poor concentration is a negative symptom. Emotional symptoms, these are usually negative symptoms such as blunted emotions. Patient must meet the criteria outlined in the DSM. The patient must have at least 2 of the following typical symptoms: delusions, disorganized or catatonic behavior, disorganized speech, hallucination, negative symptoms that are present for much of the time during the last 4 weeks. Experience considerable impairment in the ability to attend school, carry out their duties, or carry out their everyday tasks. Have symptoms that persist for 6 months or more. Most effective treatment for schizophrenia patient is usually a combination of medication, psychological counseling, self-help resources. Watch detailed lecture on sqadia.com psychology course. That's 2 minutes. See you in the next video.